Thanks, Peter. The whole country continues to face the unprecedented challenge of COVID-19. Although coronavirus struck very near the end of the year on which we're reporting today, I'm able to give you details about how we mobilised swiftly and effectively to protect our staff and service users from this challenge. Whilst not only doing this, we continued to deliver existing services and took the opportunity to take a radical look at how we could do things differently. And in some cases, we're now doing them even better. For example, today I'm speaking to you from the premises of our unit at Dragon Square. Dragon Square is an example of how we changed the ways in which we worked, and as a result have been able to restore and reopen a bedded facility to provide support for our service users, even though the virus still exists in our community and threatens our staff and service users. From the start of the challenge in March, I was very clear. We have to regularly communicate with our staff and service users. We have to keep them up to date, daily if necessary, hourly if needed, and issue them with updates, guidance and advice to guide many of them through what was a very daunting and difficult time for them. Recognising that many of the staff would be working remotely or may not always be in a position to access internal networks or emails, we made all of our communications directly from myself available on our public website, so that staff and our service users would always be able to access the very latest guidance that we were publishing on how they should access our services and how our staff should work. The second bit around this and the benefit of it is that it maximised our openness and our transparency about our response for our local community. Amongst the items on which we published guidance and provided information were guidance on inpatient services and how we're operating, COVID-19 flowcharts around how we would see individual patients and they would come into our services given the uncertainty around infection, isolation procedures, how we would effectively use our PPE equipment, staff support and HR measures, including our staff counselling and support services for those staff who may be affected, service continuity arrangements, patient visiting times, our payroll information, uniforms and workwear, supporting our junior doctors, and we established a clinical professional advisory group that would actually advise the whole trust staffed by senior clinical professionals on all the professional matters and challenges that COVID may present to us. We used our public website to provide our local communities with the most up-to-date advice and guidance from the government, NHS England and Public Health England, mirroring that guidance as it came out in an up-to-date way and interpreting how that would affect our services and how it would affect the running of our services. We published guidance and resources for our local communities to enable them to understand COVID, how to keep themselves safe, with specific advice for older people, parents, children and young people, and those with a learning disability or autism. We undertook an assessment via all of the line managers within our structure of the caring responsibilities of our staff, the ability of staff to work flexibly and alternative solutions that staff might be able to offer to ensure that services could continue to run for our service users despite the individual challenges that some of our staff would face. This assessment exercise was undertaken through our directorate structures which sit in our operational structure, and all staff worked with their line managers to complete that assessment. Where it was possible and appropriate for staff to do so, we supported them to work remotely or from home. However, we recognised that for many of our services or elements of our services that we must keep running in-person services for our service users and for the wider health economy. We deemed these services our critical services, and the maintenance of these was a priority for the Trust in terms of resources and staff deployment. Innovation was one of the key building blocks that we believe make up an outstanding organisation, and so it's as no surprise that we concentrated on harnessing innovation at the time of crisis. Good examples of this included moving significant parts of our business from largely buildings-based and desk-based operations to virtual, cloud-based operations, including both back-office functions and our patient care. Replacing some of our staff face-to-face meetings with online and digital meetings using great technology that we were able to deploy very quickly. And introducing video consultations between service users and clinicians has been a real leap forward. Particularly, we've had feedback from many service users and many clinicians saying that this has helped them access services in a more proactive way than they ever could have before COVID existed. We've equipped scores of teams with the most up-to-date laptops and mobile devices to facilitate federated working. Early in the pandemic, I remember ordering over 500 laptops and bringing them into the trust as soon as we could so that we could operate from home and staff could work remotely. We've reduced our carbon footprint through slashing the number of car journeys needed to get our people to work and the journey times between sites by utilising digital means. We've introduced exec drop-in sessions online to maintain momentum and make staff feel that they can really engage with us as a top team. And we've introduced enhanced service user risk assessments to make sure we maximise the effectiveness of our service offer, ensuring that those patients who do need to see staff face-to-face, in person, are still able to do so. Doing all of the above has been a massive undertaking over the last 6 to 9 months, but it's given us the opportunity to think big about what we can achieve when we combine confidence with determination to keep our services running to the highest quality. And we made clear that what we would do as time went on was learn from our experience and adjust things as necessary. We've done that on more occasions than I can count to make sure that we continually improve our offering. We're aware that coming out of the current coronavirus situation and returning to a new business as usual is not going to be without significant risk. So as we've looked at all of our services and how they're going to operate in the future, we've looked at every individual service and aspect of it on its own merits. Matt Johnson, our head of psychology, has led on the production of the guides, one of which is entitled Looking After Your Health and Wellbeing, Support Through the COVID-19 Crisis. These guides are openly available on our Trust website. Of course, at the heart of our delivery of our services are the fantastic staff here at Combined Healthcare. I personally couldn't have delivered what I have delivered over the last 6 to 9 months without the support of a huge number of our staff. I'd personally like to say thank you to everyone who has supported the operational effort over the last 6 to 9 months and who supported me personally in making sure that the organisation continues to run. But right now, it's my pleasure to send you across to our Director of Workforce, OD and Inclusion, Shajida Ahmed, to tell us about how we supported our people through the year end and in particular over these unprecedented times. Thank you.